Good morning again, third year medical student, Misan University College of Medicine. Continue our second lecture about diarrhea and constipation. We start here, Bristol stool chart. This should be held in the wall of clinic, from which the patient can give you description of which type of stool that he had. So you look this type 1, separated hard lump like nuts. This is hard stool. Type 2, sausage shape but lumpy, also considered as hard stool. Type 3, like sausage but with a crack on the surface. This is most likely normal stool. Type 4, like sausage or snake, smooth and soft. This is also normal stool. What about type 5, type 6, type 7? All these types from 5 to 6 and 7, these are indication of diarrhea. So this type of stool, type 5, type 6, type 7, give us indication of diarrheal stool. Prevention, hand washing, ensure the availability of safe drinking water, appropriate disposal of human waste, breastfeeding of infant and young children, safe handling and processing of food, and control of vectors like flies. What about chronic diarrhea? Chronic diarrhea defined as production of loose stool with or without an increased stool frequency for more than 4 weeks. Chronic diarrhea, bleeding, blood-bare rectum. It is blood-bare rectum, colonoscopy and biopsy. Feature, if the patient has feature suggestive of malabsorption, small bowel image, biopsy and aspiration. There is pain aggravated before bowel motion, relieved with bowel motion, sense of incomplete evacuation. You should suspect irritable bowel syndrome. No need for further assessment. No blood, feature of malabsorption, consider functional diarrhea, and you should exclude dietary cause of functional diarrhea like lactose intolerance. These are lists of drugs and poisons that associate with diarrhea. Antibiotics most commonly, antineoplastic, anti-inflammatory agent, antiarrhythmic, antihypertensive, and all these lists should be kept in mind. So what are the merit of disorder are associated with chronic diarrhea? What are the matters or what are the points you should look for in the history or in the assessment of patient with a chronic diarrhea? The prevalence of a specific disorder varies based upon the practice setting. In developed country, common causes are irritable bowel syndrome, inflammatory bowel disease, malabsorption syndrome such as lactose intolerance and celiac disease, and chronic infection, particularly in patients with immunocompromised status. The minimum laboratory evaluation in most patients should include patients with chronic diarrhea for more than 1 month, complete blood count, differential thyroid function test, very important, serum electrolyte, very important, total protein and albumin and stool, occult blood, endoscopic evaluation, sigmoidoscopy, colonoscopy, sometimes upper endoscopy, depending on the clinical setting. Complete blood count differential, looking for B12 deficiency, hypersegmented neutrophil, electrolyte, and total protein and albumin malabsorption syndrome. Alcoholic patient, stool for occult blood, searching for malignancy, thyroid function test, looking for thyrotoxicosis as a cause of chronic diarrhea, and endoscopic examination is very important. Now, what about the 14 points should be assessed as part of comprehensive history in patient with chronic diarrhea? The character and the onset of diarrhea, very important. The pattern of diarrhea should be recorded. This is also very important. Duration of symptoms should be identified. Epidemiological factor, any history of traveling, very important. Stool characteristic, Bristol chart. Presence or absence of fecal incontinence, important. The presence of absence of abdominal pain is consistent with the ischemic bowel disease. The presence of weight loss, malabsorption syndrome, or malignancy. Aggravating factor, diet, etc. should be recorded. Mitigating factor, alteration of diet and use of both prescription and over. Ask the patient if he used drugs without doctor prescription. Previous evaluation should be reviewed. Previous history of diarrhea. Iatrogenic cause of diarrhea, like history of radiation or surgery. Let us say surgery for bypass surgery. And lastly, factitious diarrhea caused by surreptitious laxative ingestion. And this is usually common practice in young female or those female who want to get weight loss, rapid weight loss. Careful review of system should be conducted to look for systemic diseases such as hyperthyroidism, diabetes mellitus, collagen vascular disease, inflammatory bowel disease, tumor, acquired immune deficiency, and other problems. We stop here, and now we will continue about constipation. What about constipation? How we define constipation? Constipation is hard stool, infrequent stool, less than 3 per week. It is with excessive straining, sense of incomplete rectal evacuation, excessive and successful time spent on toilet. Constipation is defined as any two of the following features: straining, lumping, hard stool sensation, or incomplete evacuation. Use digital maneuver sensation of anorectal obstruction and decrease in stool frequency. Symptom of constipation: patient have nausea, abdominal pain, loss of appetite, lethargy, depression, and patient may not associated with these symptoms. Causes of constipation. What are the causes of constipation? Cause of constipation could be dietary, lack of fiber, this common Western lifestyle, motility, slow transient constipation due to drugs or due to, let us say, diabetes, cause delay gastric emptying, a motility disorder, irritable bowel syndrome, can present with constipation, structural cause, diverticular and CA, defecation, obstructive of defecation, hard stool, obstruct the path of other stool, drug, chronic intestinal pseudo-obstruction, adhesion, and reopening of the bowel, Hertz-Spring disease, usually in pediatric age group, anorectal disease, chronic or Crohn's disease, and hemorrhoid. Non-GIT cause of constipation: drugs, opioid, anticholinergic, calcium antagonist, opioid, morphine, bethidine, anticholinergic, antispasmine, atropine, calcium antagonist agent, neurological, multiple sclerosis, spinal cord compression, metabolic, diabetes mellitus, hypercalcemia, others, any serious illness with immobility, iron supplement, aluminium containing antacid, CVA, those patients, CVA, Parkinson's disease, hypothyroidism, and pregnancy. And for this, I make a circle. I have patient, I remember patient pregnant having 4 months constipation. 4 months constipation, no bowel motion since 4 months. And this is part of normal physiology due to pressure of uterus on the bowel, but this is rare. Depression can cause constipation. What are some consequences of constipation? As I mentioned before, nausea, vomiting, behavioral disturbance, and dementia, extra staff time, need to increase toilet need, overall increased number of medication in the region. So this is consequence of constipation in elderly. What is mentioned, what's important to remember here, the constipation is not part of aging, but commonly seen in elderly. Commonly seen in elderly. And these are the causes: dementia, a lot of medications, immobility, and etc. Some medication associated with constipation mentioned before. This is another medication. Stepping out, getting out, أو التخلص من constipation. We start with exercise. No evidence that increased exercise beneficial. Exercise improve pelvic muscle, pelvic floor muscle. High fiber diet, 25 to 30 جرام. احنا ما شاء الله fiber diet مالتنا كلها خبز، يعني rich fiber diet. Less dehydration, increase fluid does not relieve, not a lot of fluid can relieve constipation unless you have dehydrated. The kitchen can help. يفيد المطبخ. نعم. added dry fresh or canned fruit. زيد البقوليات، زيد الفواكه. added legumes to soup. Casseroles include grated vegetables and rissoles, soup, choose fruit, dessert, use high fiber snacks, raisin bread, date, scones and carrot and muffins. حاول تكثر من الخضروات والفواكه والبقوليات لأن كلها تزيد حركة الأمعاء. Bulk forming laxative. Now to medicine. Psyllium, one of the drugs used for bulk forming laxative, improves stool consistency and frequency with regular use, ensure good fluid intake, onset usual 2 to 3 days, side effect is flatulence. Stool softener, lubricant, paraffin oil, commonly used in clinical practice. Efficacy of docusate is controversial. May be useful anal fissure or hemorrhoid. Liquid paraffin is not recommended treatment of constipation. Those patients with risk of pneumonia because of absorption of lipid, lipoid pneumonia. Long-term use may result in depletion of vitamin-dependent fat like A, D, E, and K. Osmotic laxative, commonly used in clinical practice and usually in patients with chronic liver diseases and with diabetes. Lactulose, sorbitol, effective, usually occur up to 48 hours. Metabolized by bacteria, causing flatulence. Movical, also another osmotic laxative used in clinical practice, also commonly used nowadays. Stimulant laxative, Lyxina, which is natural plant in origin, increase intestinal motility, useful with opioid. This can be used safely with a pregnancy, constipation with a pregnancy. Generally consider second-line therapy in elderly. Adverse effect can cause diarrhea. Enema and suppositories. It is important to mention that enema and suppositories are part of the treatment of constipation after fail of all previous treatment. Used to rapid relief of symptom. Frequent use may cause rectal incontinence. It's a very important issue. And whenever you use enema, use warm water enema, safer for regular use. Botulinum toxin injection into the muscle of puborectalis or subtotal colectomy can be used part of treatment of constipation. This is investigational and usually not done in routine practice. Helping to prevent constipation, patient education, diet and fluid intake, exercise, bowel habits, toilet facilities, medications review, ensure laxative. طبعا نحكي على التواليت فاسيلتيز يعني مثلا من تروح للحج يعني facilities of toilet, it was so difficult. You should be in the queue for about 2 to 3 hours. So sometimes holding the bowel motion can cause constipation and harm you. Thank you very much for listening.